Welcome back. This is part 2 in the series where I teach you how to look for infection in your child and adolescent intakes. We looked at Lyme disease, we looked at Bartonella, and today we are going to look at Babesia as well as Strep. Now, Babesia can come from ticks. What you might want to look for in terms of this kind of infection would be anxiety, panic, depression. These kids will be the kiddos who come into your practice in the winter in their shorts because they run hot. There might be some night sweats going on. There might be some low-grade fevers. They might resist a coat. Strep obviously doesn't come from ticks, but strep can absolutely cause mental health conditions. So when we are thinking about strep, we oftentimes will think of strep throat, but I want you to think a little bit beyond strep throat. Sometimes kiddos will have a tummy ache that comes with strep, a tummy ache that might come and go. Sometimes strep manifests in the throat. Sometimes doctors might find it more with a rectal exam. Sometimes it would just be blood levels. An ASO titer is one test, and anti-DNase is another test. Those look at short-lived infection where I have just recently been exposed, and then it also looks at, let's stretch this out and see if I was exposed a while ago. Those kind of numbers, those kind of labs are important for doctors to see because they can see if the numbers are decreasing in time. But strep presentation really can come with a very scattered look, a very ADHD kind of feel. It can come with a lot of panic, a lot of anxiety. It can come with depression. So it's very interesting and very important for us to really be thinking about, could infection be playing a role? All kids do not present the same. It's important for us to know. They might just have a clustering here and there of different symptoms, so that's important to know. I worked for 7 years with a Lyme literate doctor. She sent me a good bit of her patient, and I learned rather quickly that those kiddos and those adults were really complicated, and their symptoms were presenting in kind of a confusing way. I would see very, very high-functioning adults, let's say, who were paranoid, or very high-functioning adults who would have panic attacks before board meetings. How do they get there? How do they become so successful, but yet some of their symptoms were so debilitating? Insert infection. Insert a reason why something isn't really making that much clinical sense. Encephalitis, remember that is the inflammation in the brain, can cause a whole host of symptoms. While I worked in that practice with that physician, I also learned that I had Lyme, Babesia, and Bartonella. My husband, Lyme, Bartonella, Babesia, and Strep. These infections, these tick-borne illness infections, are sexually transmittable and gestationally transmittable. So I didn't know I had these infections when I was pregnant. I'm going to walk you through rather quickly how all 4 of us presented very differently. So I grew up in the country, running around barefooted. My mother was very healthy, very organic. We had our own humongous garden. We drank raw, unpasteurized, unhomogenized milk. We got our eggs from a farm. We were part of a co-op. And there were so many ways in which our immune systems were constantly being strengthened by my mom and by our way of living. And so what became interesting, though, was that I developed a tic disorder. It was in my lips, it was in my eyes. I would do these kind of interesting little behaviors with my face. My sister developed this tic disorder in her throat. She would make these sounds with her throat and her mouth. My brother developed like a little jerking of his hands. My neighbor had a tic disorder. His mother had a tic disorder. Wait a minute. And these would come and go. Something's not right. That's about as bad as it got. Probably because my immune system was so healthy. Fast forward, going to college, eating a bunch of processed foods, and then I started having babies. By the time I had my second child, which means my husband and I were sexually active, obviously, right? My body began to tank. I lost a good bit of my vision. My eyes, one of my eyes has really bad scarring on it. I mean, I lost color at one point. I was getting migraines. One by one, systems in my body began to really cry out for help. I had pancreatitis. I was the only 25-year-old, teeny tiny 100-pound girl in the hospital with pancreatitis. It was weird. I developed problems with my ovaries. I developed problems with my appendix, had to get that taken out. Systems of my body began to really cry out and say, something is wrong, something is wrong. Let's go to my husband. My husband grew up in the country too, different part of the United States. He came in with his own batch of infection. When we became sexually active, my infection mingled with his. Woo! My body didn't know how to handle it. Neither did his. His presented more brain. His presented with episodes of mania and depression, with ADHD kind of focusing problems that were so bad it was impacting how he could perform at work. His was so brain focused. The brain fog was so tremendous. His fatigue was so tremendous. I wasn't fatigued. I was still at the gym. In fact, if I stayed at the gym and I made sure I went to the gym every other day, I could control a lot of the pain that would rise up in my neck or in my shoulders. Again, I didn't really know. My daughter was born with really bad allergies, severe colic. I mean, we're talking screaming so much she would lose her voice. She had reflux, she had gastric problems. That's key in the gestational little ones. That happens a lot. Her little brain started to really become affected when she was in first grade. Her memory started to disappear. She couldn't remember her math facts. We would be playing in the neighborhood. A car would be coming. She would see it, and then she would forget and run out in front. 3 times in a day that happened, to where I was going like, my daughter's memory. What is happening to my daughter's memory? She was becoming very curious and very engrossed in vampires and just dark, dark things. Something was different and something was wrong. My son, completely different presentation than my daughter. He was 3 when he started to really show physical signs. We would have to carry him off the soccer field because he'd cry because his legs hurt so much. It was really sad. Sometimes he could take the stairs fine. Other times he would cry because his legs hurt too much. We would have to carry him. We would be walking around in Harris Teeter, our grocery store. Sometimes that was too much. He would need to go in the cart. He just fatigued. Very, very different presentation. At 3, I took him to the this is before I was diagnosed. I took him to the pediatrician and said, I'm suspecting Lyme disease. I'm seeing it in some of my clients at work. I'm suspecting it. Can you please run some blood levels? The doctor looked at his knees and said, his knees are fine. He's fine. I'm not going to test him. It wasn't until a year later to where a Lyme literate physician was able to diagnose him and the whole family. By this time, guys, he stopped growing for maybe a year. He didn't grow, barely at all. He had a lot of food sensitivities, some other gastric problems that were very different from my daughter's, but still he had to see a gastroenterologist. The presentation may be different. But if there are enough symptoms, become curious. Don't just say, he's hearing voices, this must be schizophrenia. This child is suicidal, he probably needs to go into the hospital. I have to tell you, the number of eating disorders that have been because of Babesia, because of Lyme. I had one girl who was down, I think, 30 or 40 pounds because of anorexia. And then she was diagnosed with Babesia, and she was diagnosed with Strep and Lyme disease. And then once the infections started to be treated and the infection started to stir up, it changed and it went the other direction. And then it became like eating. And she passed her baseline and went way up, like 30 pounds the other direction. Be thinking in your mind, could this be something else? Because I don't believe in straight up diagnoses anymore. I don't. I see gene mutations that can cause mental health problems. I see lots and lots of infections. I see gut health that can cause lots and lots of problems. So when somebody says bipolar's in my family, I just put that on the shelf and say, okay. You know why? Because we all have our own genetic dispositions. We do. And when we have something that impacts us at the autoimmune level, our genetic coding is going to really help determine what kind of symptoms we're going to have. Is it really going to look very arthritic in you? Is it going to attack more of your brain? Are you going to present with more of a bipolar feel about you? Are you going to present with a good bit of paranoia? A lot of it has to do with A, what infection do you have? B, how's your gut health? How are you managing them? C, are you detoxing? Are you able to detox everything that's going on inside of your body? B, what kind of genetic coding do you have? It's a lot to take in. But I hope this helps you become curious, because our intakes aren't just about gathering information and just slapping on a diagnosis. It's not enough. The information is out there. It's our job as clinicians, as intelligent clinicians, to be as well informed as we can be. Because when we see a client and they come to us with an illness, and we don't educate ourselves enough to be able to catch that illness and send them to the right doctor who can properly diagnose and properly treat, it's a disservice. Because guess what's going to happen? Our clients are going to get more and more and more sick. Some of these children are going to have to be institutionalized. They're going to have to go into residential care. They're going to be in and out of the hospital for the next number of years. But it can be prevented if you know what to look for. I stopped sending children back to their pediatrician for testing because it's so complicated. So I send kids to physicians who know the battery of tests to run, lab work to run, clinical things to look for, just to make it easier. So I am happy to send you lists of doctors if that might be helpful for you. Reach out to me via my website. Email is best. You can start on my website and then take off from the different websites that I have listed. Please share the word with your fellow psychiatrists, your fellow physicians, your fellow therapists, that enough is enough. We need to know what to look for, and we need to find it in our families and our children and on the adults that we see.